Welcome everybody to GoLocal Live. I'm Josh Fenton, CEO and co-founder. It's Wednesday. We've got Dr. Phil Chan on. Dr. Chan, thanks so much for joining us.
Good morning. Pleasure to be here.
So a lot of things going on in healthcare, obviously, at virtually every level, but one development that's taken place over the past few days has related to NIH grants. Rhode Island was the recipient of a significant number. You were the recipient of a number of NIH grants, and there's been some legal decisions. Let's jump into it. Why don't you give an overview of your involvement in this issue?
So the NIH stands for the National Institutes of Health and is the main institution at the federal level that funds science and clinical research here in the US. It's really one of the crown jewels of science and innovation. It's the leading organization that funds biomedical research throughout the world. And I've been a lucky recipient to have several grants from the NIH over time, including a couple that were recently terminated.
Okay, so those were terminated. What were they for? How much was it for?
So I've had 3 grants in total from the NIH terminated. The 2 bigger ones, one was focused on improving the mental health of the LGBTQ community. That was the title. And the second one was focused on looking at HIV pre-exposure prophylaxis. That's a pill a day to prevent HIV among Black and Hispanic, Latino, gay and bisexual men.
Okay, and it was your take when you got notified that these were targeted because of sort of the Trump administration's targeting of, DEI, gay and lesbian and health initiatives?
Exactly. In fact, we all got letters about that, and those were some of those exact wording, saying that one of them was canceled because of the focus on gender or the inclusion of gender. It wasn't even focused on gender, it just included gender diverse individuals, and that these grants no longer effectuated the NIH priorities at this time. And I will add, too, that the canceling and termination of these grants is highly irregular and really has not happened before. Prior to this point, you had to do something really, really bad, if not illegal, in order to get grants terminated. And with this administration canceling grants, it was really something that had never been happened before and really, frankly, surprised a lot of us.
This week, I believe was it Monday? A federal court judge in Massachusetts sort of stayed the cutting of these grants, and that's the next stage in this national debate.
Yeah, and I think, if you read the judge's decision, he said that it was probably illegal, that it appeared to be discriminatory to the LGBTQ community, to folks from different racial backgrounds, et cetera. And, I think it backs up what many of us are saying. I mean, look, these grants were not focused on DEI. They were focused on communities that are impacted most by things like HIV, like mental health. The lessons we learned from these grants really apply to all Americans, regardless of backgrounds. But for myself as a scientist, for others in public health, yes, we focus these grants on communities that are affected most by these health disparities. And unfortunately, that still includes African American, Black, Hispanic, Latino, and LGBTQ communities. And that's why these grants were focused on those populations.
What takes place now? I mean, you shut those programs down, correct?
We had to let a few people go. And these grants were not just here in Rhode Island, but they included sites in, for example, Washington, D.C. and Mississippi. So yes, some of the other sites stopped. We actually continued some of the work here because of our ethical obligations to continue, for example, providing PrEP to some of these communities, but large parts of these programs have shut down.
And those workers got displaced. They got laid off. They're working on the next phases of their lives, right?
Yes. So we had to lay off for one of these grant terminations across a couple sites. We had to lay off at least 4 people that I'm aware of lost their jobs due to these grant cuts.
So what takes place now that the judge has found this ruling? Are you going to try and restart these programs and get them going again? Are you going to wait until the government appeals? It was at the First Circuit Court of Appeals, so up in Boston, I think. Or was it at the district court level? Regardless, the Trump administration has been aggressive in appealing these things, And some of these things have gone all the way to the Supreme Court already.
And the other thing too to consider is that it's not clear exactly which grants this ruling affects. We are pretty sure it affects our grants, but we haven't received official notification yet. And from listening to some of the correspondence from the lawsuit here, it wasn't clear exactly either. So we're still awaiting official word. Once we get official word, yes, we'll certainly explore whether or not we can move forward with funding and therefore the study.
Of those grants that got terminated by the Trump administration, were there outstanding balances at the point in which they were terminated, and were those funds that had been obligated under the Biden administration been paid to the date in which they were terminated?
Yes, so the grants were paid up until the date that they were terminated. And a lot of these grants too were canceled in the name of efficiency. The first grant that I mentioned, looking at mental health outcomes among the LGBTQ community, we're studying a novel intervention here at Open Door Health. We'd already enrolled over 200 people. We were in the final stages of completing that study. It was a 3-year study. We were already in year 3, and the grant was canceled without any, real reason other than the inclusion of gender folks in that study. And that to me, just from an efficiency standpoint, didn't make any sense because we were so far along. We had already spent down most of the grant. We were finalizing data and follow-ups in that grant, and it was just canceled. So to me, that's an example of, frankly, a waste in terms of just stopping these grants and cutting them when we were so close to finishing and getting those final results.
And so what do you do now? Do you wait for an interpretation by the lawyers who are representing the lawsuit? Do you wait from notification from NIH? Do you restart and start billing? What's the next step in this process?
So we're going to be waiting for official notification. We have to make sure that our grants were the ones that were included in this lawsuit, because as I mentioned, it's not clear. And this is also complicated by the fact that some of these grants go through Brown University, and Brown also hasn't been paid in months and months, and it's not clear about the status of the NIH grant funding with Brown. So there's some complex issues here. It's going to continue to play out in court. It may reach eventually the Supreme Court, maybe my guess. And so we're in sort of this wait and see phase.
Yeah, I mean, it's wildly complex. I think we're the first to write about the cancellation of these grants a few months ago. There were about 30 of them or so, impacting a lot of different health initiatives. Brown University is in the midst of legal disputes with the U.S. Department of Education, as well as sort of this blanket Trump administration supposedly freezing over $500 million of federal funds that go through Brown University in some way. That hasn't advanced very far. Obviously, Harvard is in a numerous group of legal fights with the Trump administration relating everything to foreign students, to NIH grants, et cetera. How much of, for you, a healthcare professional who's seeing patients and overseeing grants and trying to get people healthier, how much of your time in the past few months has been pulled off what your core efforts are and shifted over to kind of this administrative chaos and legal battling?
I mean, a significant amount of time, Josh, and it makes me sad. Healthcare in general is overwhelmed. There's an overwhelming demand for medical health services in general, and just to have this added layer of drama and challenges to the whole situation is really disappointing. And it really saddens me that about these attacks and threats to science and the NIH. The NIH, as I mentioned, is a crown jewel of American science and innovation. It's one of the reasons why we have been a leader in the world. People respect us because of our science and our medicine so much. The NIH has enjoyed bipartisan support for so long. The budget for the NIH in fiscal year 24 was $47 billion. And as many people know, we're seeing proposed budgets to the federal government, and the NIH is having a 40% proposed budget reduction for this next year. And that's really going to hit that's going to hit us at this intersection of science and medicine and innovation. And we really are going to see this, the repercussions for years to come.
Well, it's the science and the innovation, but it's also the business. I mean, the innovations that take place there then go into the private sector and create jobs at, in part with pharmaceutical companies and medical device companies and across the board. And, you know, here in Rhode Island, we're trying to get a fledgling, and I do mean a fledgling, biotech industry started. And, you know, we had a little success and created 250 jobs. And then Vertex Pharmaceutical up in Boston, of some existing jobs, lays off 125. So, you know, these trying to create a new business sector is pretty hard to do, and it's especially hard to do if the federal government is kind of slashing the core elements of the foundation of that with cutting NIH grants and other science-based grants.
And there's good data, Josh, to show that every dollar of investment in the NIH leads to at least a doubling, more than a doubling and a half of economic activity in the community as well. So investing in science is investing in jobs and the economy. And more than that, you know, it's investing in the health of America. I mean, one stat that we is routinely shown is that America ranks, you know, far below some of these European countries in terms of health and well-being and different health measures. And the NIH in this research is what makes America so competitive. So we're not just going to see reductions in you know, economy, finances, but eventually we're going to see even further decreases in health and well-being of our country in general, developments in cancer, in infectious diseases, all these medications and treatments that the NIH routinely researches is going to decrease.
You know, final question. What are you waiting for next? Communication from de facto, the lawyers representing you, the grantees?
Yes, official communications from the court, official communication from the NIH to our institutions, and then communications from our institutions to us as the leaders of the grant is kind of the flow of things.
Well, I've got you one final question. On Friday, it's always on a Friday, bad news coming out of government. OHIC, the Office of the Insurance Commissioner, sent out a press release announcing that the healthcare insurance companies in Rhode Island were asking for, other than one exception in one subgroup, rate increases between 20% and 28%. Obviously, that is a major blow to employers and those who pay individually. Your thoughts on that? I'm assuming if they're getting a 28% rate increase, that's not going to trickle through to you primary care doctors, but it further exposes the financial weakness of our entire healthcare system in Rhode Island.
I do know that the insurers have been reporting that they have been operating in the red. And I think at the end of the day, the most important thing, Josh, is exactly as you mentioned it, which is we need to see more money flow into primary care clinics, other healthcare organizations, and also to the providers and the staff. I mean, there's protests going on. We're not competitive with other states where, you know, most of us are paid 20 to 30% below other doctors in Massachusetts, Connecticut. So at the end of the day, regardless of the rate increases that the insurers are requesting, we need to see more money flow down into the practices, the healthcare setting. And at the same time, we really need to reduce some of the administrative burden that is often imposed upon us clinics and physicians by insurers and other healthcare organizations like that. The administrative burden that is being pushed on us is just, you know, prior auths, is just unsustainable and a major cause of burnout in the healthcare community.
You know, one of the reasons that they list as the reason for this massive rate increase, the biggest I think in decades, is the cost of GLP-1s. But shouldn't over time the cost of GLP-1s then have a significant benefit to health insurers? Because as people get healthier, reduced heart disease, reduced diabetes, reduce weight, reduce thus cancer, which has linkages to obesity, shouldn't there be a significant advantage to the overall health and cost to the Rhode Island healthcare system?
There should be, yes. I spend a lot of my time now talking about GLP-1 receptor agonists. We talked about it on this segment before. A lot of people are interested. They're very, very expensive to pay out of pocket, hundreds and hundreds, thousands and thousands of dollars per year. The other issue that complicates this, Josh, as well, is that these medications are much, much cheaper in other countries like Europe. So part of the conversation here really needs to be working towards decreasing drug prices so it doesn't bankrupt Medicaid, Medicare. The pharmaceutical companies are making a lot of money off of some of these brand name drugs, whereas other countries are able to negotiate steep discounts, et cetera. So we need to leverage some of our power of Medicare, Medicaid to also negotiate discounted drug prices.
With that, Dr. Phil Chan, we always appreciate your insights. For everybody else, stay tuned. We'll have Mott and Chase up at 11 o'clock. We'll have updates throughout the day. If you haven't seen it, a couple big updates this morning. One, a terrible incident that took place late yesterday. We've got the video of it. A fight that turned into a shooting that turned into a hit and run incident with a woman significantly injured. And also the Atlantic Mill Complex in Olneyville has sold. And we've got some of the details waiting for more. Thanks, everybody. Stay tuned for much more.